Hello. I hope we've met, but if we haven't, I'm Helen Greatorex and I'm still the relatively new Chief Executive for KMPT. If you see me out and about, do please come and say hello. It's always good to meet new colleagues. I've made this really short film to talk to you about the publication of the Sustainability and Transformation Plan for Kent and Medway. This is something I've been involved in along with all the other Chief Executives across the patch since I joined actually, and it predated my arrival in June. You will no doubt have seen in the press lots of coverage about publication of plans, about why plans are being published. I think it's a really good thing. The driver is clearly reducing cost and getting the NHS back into balance. As you all know, we've got financial problems in our own organisation and we're forecasting a deficit of over £4 million at the end of this year, and that's not where we want to be, and we're obviously working on improving that position. But across the NHS nationally, we know that we're currently spending way more money than we have, and that actually our quality of services isn't as good as it could be consistently. So the driver for the STPs, for short, is doing those two things, is improving quality and reducing the cost and getting us back into balance. What does it mean for us in KMPT? Well, actually, I think it's a good news story. There's never been a better time to be working in mental health. And as someone who's worked in mental health services now for 33 years and 1 month, I can honestly say that I think at last, after all these decades, our voices are being heard. So I would really encourage you to get involved. There's a clinical cabinet that's led by GP Dr. Sarah Phillips. Our own Executive Medical Director, Dr. Catherine Kinnan, is well involved in the discussions about clinical pathways. I'm part of the governance group of Chief Executives who are making sure that whatever the STP does delivers the best for all patients, including KMPT patients. And you will find increasingly groups and discussions being set up, and perhaps your existing meetings too, talking about how things are changing. Just to give you some examples of where in our organisation, focusing on reducing cost and improving quality simultaneously is working. I've been really impressed since I've joined KMPT at the level of clinical commitment and leadership in partnership with management to improve things. Perhaps the biggest example of that so far has been our successful reduction of use of out-of-area or private beds. In June we were spending over £1 million a month. Over £1 million a month. We were sending patients off to Manchester, Hull, just awful, and sometimes in the middle of the night because we didn't have sufficient capacity in our own beds. And thanks to what I have to say is epic leadership from some key colleagues, including Dr. Matthew Debenham, we've tackled that. We set ourselves an ambitious trajectory, but one that we believed we could meet, and we'd said that from the 1st of November, we would not have anyone in private beds. And we've achieved that. And that has meant that the quality of care we're able to provide is much better. That means we're admitting people as close to their own home locally as possible. But it also means that we're not wasting money on private beds where the quality actually was variable, to say the least. So that's a good news story, and it has stopped us spending money that actually we didn't have in the first place, and it's improved quality. At the same time, the driver was quality, because even if those beds had been free, it was so wrong to be sending patients in the middle of the night all the way to Hull, those poor patients and their families, and none of us wanted to do it. I know in the trust we were in a tough place, but we've resolved it, and I guess that's why I'm citing it as an example on this message about how I do believe that we can do the two things at once. You can have the driver for improving quality, which ultimately, because we're doing things more effectively, will reduce cost. Other initiatives in this trust include, obviously, and you'll know, especially if you're currently working in teams where we've got a high use of temporary staff, getting the best staff and holding on to them. So you'll have met, I'm sure, our Director of Human Resources, Sandra Goatley. Sandra comes very usefully not from an NHS background, and that means that she's brought a whole host of innovative, creative, dynamic and much faster, I have to say, ideas about recruiting and retaining the best staff. And again, it's another example of where you can drive quality up quickly and take cost out quite significantly. Our single point of access is another initiative, and if you think about the STP overall, one of its key aims is to stop bouncing people around the system. So instead of our patients having a poor time when they go through A&E, for example, or when they have physical healthcare problems, or when they need screening, we know that our patients are significantly disadvantaged. People with a mental health diagnosis, as I'm sure you'll know, are likely to die 10 to 20 years sooner than the rest of the population, and that's just a tragedy that is so avoidable. So for us in our services, I would say the STP is a good thing. Please get involved, get your voice heard. If you're on Twitter, get on Twitter. If you're on Facebook, join the groups that are talking about it. If you're a nurse, join We Nurses on Twitter and get involved in those conversations. Really important, whatever your role in KMPT is, that you feel you're connected with what's going on outside the organisation and know how to get involved. And as I say, as I sign off on my first blog, if you see me out and about, please do come and say hello to me. It's a joy to meet new colleagues, and I'm really enjoying being here at KMPT. See you again soon. Bye.